Okay, sorry for interruption. Yesterday I am talking about the blood pressure readings, how to take the blood pressure for wrist blood pressure machine and digital machines. So manual blood pressure readings, how to take, this topic is pending, I'll take later. So today I'll cover the some key points, because previously I told you that there are four pressures are there. What are the four pressures? First one is systolic blood pressure, next one is diastolic blood pressure, third one is the mean arterial pressure. In short form, we are using MAP. And next one is the PP or pulse pressure. So we know by the machine we can take the systolic blood pressure and diastolic blood pressure. So how to get the MAP and pulse pressure? So MAP is very important in our clinical scenarios, and some hospital 5 parameters or ICU monitors have calculating the MAP automatically, but we are simply calculate by our math. Okay. So what are the MAP formula? So I can write MAP or mean arterial pressure equals to 2 into DBP, means diastolic blood pressure, plus SBP, means systolic blood pressure, whole divided by 3, and this unit is mm of Hg, millimeter of mercury. Okay, so just take one example. So maybe some X person having blood pressure of 110 by 70. Just imagine, okay, mm of Hg. So this is the systolic one, this is the diastolic one. So how to get the mean arterial blood pressure? So comes to the formula. So 2 into DBP plus SBP whole divided by 3, unit mm of Hg. Okay, so here there comes 2 into DBP is 70 plus SBP is systolic blood pressure is 110 whole divided by 3. So here 140 plus 110 divided by 3. So here comes 250 divided by 3. So what is come? So our MAP will become around 83.33 something mm of Hg. So what is MAP? So MAP means nothing but MAP actually means in entire cardiac cycle the pressure is maintained constant. That is called mean arterial pressure. Means in one cardiac cycle how much the pressure will be constant. Okay, means here is the systolic blood pressure, here is the diastolic. So how much blood pressure is the constant in one vessels? Here is, you can think it is the artery. So here blood will come and pushing the arteries wall. So in one pressure is constant. So what is that pressure? That is called mean arterial pressure. So the normal times is nothing but normal. I can write is 70 to 100 mm of Hg. So what happened? It's also indicate the organ perfusion. So it is very important for the organ perfusion. So less than 60 mm of Hg means what? It's the means the in our body the vital organs didn't get the proper oxygenation blood, means the perfusion is not happening properly. So we have always maintained in shock patient also more than 60 mm of Hg for our MAP. So in shock patients and all the road traffic accident patient, we have to maintain the 60, above 60. Some books are said above 65, but do not cross the 60. We have to use some IV fluids, vasopressors and all. So this is the MAP. Next I will show you the pulse pressure. So now I am talking about the pulse pressure or PP. So pulse pressure means what? In one blood pressure we are getting the two readings, like 120 by 80, right? So in 120 by 80, the what is the difference between systolic and diastolic pressure? So that is called pulse pressure. Means what? So here I am taking one example, 120 by 80, and the formula is SBP, in systolic blood pressure, minus DBP or diastolic blood pressure equals to pulse pressure. Okay, and the unit is millimeter of mercury. So pulse pressure here is comes 120 minus 80 mm of Hg. So here comes 40 mm of Hg is the pulse pressure, right? So here we can demonstrate the those who are having high BP, like 160 by 92. That time the pulse pressure means the variability is so much, so we can detect by the pulse pressure. Okay, so what is the normal range? So comes to the normal range. Normal is okay, so normal range is 40 to 60 mm of Hg. Okay, so if less than 40 means it's having narrow pulse pressure, and it's more than 60 it means wide pulse pressure. Okay, so this is the pulse pressure. So next we'll talking about the pulse oximetry. Okay, so sorry for that video quality because I am using my hand. I have one tripod that attached with one ring light, and that tripod also broken, so I am handling by the hands. That's why the video is little bit of shakery.